So what would you go this time to do more, around this implant aesthetics for this treatment options? Thank you.
It's such an interesting question, because today the different types of options that we have as restorative dentists are so much more significant than what we used to have, yet the outcomes are not significantly better than we used to have. And the reason I believe that that really becomes an issue is many times we're being fooled by some of the companies, and I call this product seduction, where you think the product is going to solve your problems, when in the long run it has to do a lot more with biology. Restoring implants is not difficult, but actually the planning and understanding the needs of the patient. You mentioned the aesthetic needs of the patient as one, the psychology of the patient, another one. It's sometimes very frustrating when you replace a single molar with an implant, and we're so proud of the fact that we can do that, and the patient comes back and complains about packing food between the gingival embrasures. And many times their complaints do not seem fair regarding the nature of the procedure, because we don't feel the patient can always respect or realize the difficulties in what we had to fulfill in order to get the results we even achieve. I also think that many times the results we see on the lecture circuit may be very misleading, because everybody shows their best work. This is a problem, by the way. I'm sure everybody knows what Facebook is, but if you think about it, what do you see on Facebook? Only things that people want you to see. So people in the world are suffering from Facebook envy, because they think everybody's life is so perfect. You don't see any problems. I intend to come and show you problems. I intend to show you failures. I intend to show you things that I think are a problem when you get to the end. The patients have spent, many of them, significant amount of money, and to find out at the end of treatment that they're not happy, or we weren't able to exceed their expectations, is truly devastating in practice. And the more training I have, the less I seem to be able to accept that very well, because I feel that I shouldn't have these problems anymore. And we're in a situation now where we have the potential for so much training. In the world that we're in, it's becoming very odd, because I have so much training and so much skill. There's no one on my staff that can afford me. And something is also wrong with that. We need to be able to provide more opportunities to expand the needs of dentistry to help more of humanity, and the management of occlusion and implants and many of the restorative things I'll be talking about. I want to be able to bring to you opportunities that can help people at all different levels of care. In my practice, I don't care whether you come into my operatory and you rode in on your own bicycle or flew in on your own Learjet. You deserve the same expertise when you sit in the chair. And so I hope to be able to provide those opportunities so we can expand what we can do in practice, and that relieves the frustration of what I feel many people feel in practice, where they have the training and they don't get to implement or use the training because the patients either can't afford the treatment or don't appreciate what we have to offer. I think we could make significant changes.